Good afternoon. My name is Tanya. I am a nurse practitioner student for Franklin University, giving an ER report. For my patient is a 15-year-old male presenting with acute right-sided testicular pain. My primary concern is testicular torsion, which is a surgical emergency. Testicular torsion causes twisting of the spermatic cord and interruption of blood flow to the testicles. The patient reports that the pain began suddenly about 2 hours ago while he was at home. He described the pain as severe, constant, and localized primarily to the right testicle, and some radiation to the lower right, into the radiation to the lower abdomen. He reports associated nausea, but denies any vomiting. He denies any recent trauma, any dysuria, urinary frequency, penile discharge, or a fever. There is no known history for or suspect for sexual transmitted infections. He states that he has not experienced anything like this before. There is no significant past medical history for this patient. He is currently not taking any medications. On examination, the patient appears very uncomfortable and is guarding the right side. His vital signs are currently stable. Blood pressure is 124 over 74. Heart rate is 96. Heart rate is 96. Respiration is 18. His temp is 98.4, and his oxygen is 99% on room air. On the genitalia exam, the right sided testicle is tender, elevated compared to the left, and he has an abnormal horizontal position. The right cremesenteric reflex is absent, which is indicative of testicular torsion. There is no obvious penile discharge or significant scrotal trauma. The abdomen is soft with a mild right lower quadrant discomfort, but no significant rebounding or guarding. The presentation is highly concerning for right testicular torsion. The sudden onset, the absence of the cremesenteric reflex strongly supports this diagnosis. Differential diagnosis includes inguinal hernia, torsion of the appendix testis, traumatic injury, none of which that he said he has sustained. However, the acute presentation and physical examination find that makes testicular torsion the leading diagnosis. While in the clinic, the patient has been kept NPO on monitoring. We have established IV access. We have given him fluids, normal saline at 75. We have given him um, uh, Zofran 4 milligrams and morphine 4 milligrams IV. Uh, no attempt. We need to get him transferred to emergency room in order to get a Doppler ultrasound so we can check the testicular blood flow. And he need rapid evaluation and surgical intervention. The plan is to arrange for immediate transfer to the emergency department with pediatric urology and appropriate surgical capability. The receiving facility, I will notify them that this is a 15-year-old male with suspected right-sided testicular torsion approximately 2 hours ago of acute symptoms. The patient will remain NPO, continues to be monitored, and receive supportive care during transport. All pertinent vital signs, medications, and administration in the time of the symptom onset will be communicated to the receiving team. In summary, this is a 15-year-old male with sudden right-sided testicular pain, nausea, elevated horizontally positioned right testicle, and an absent cremesenteric reflex. He is currently stable but has suspected a right testicular torsion requiring immediate emergency surgery. Thank you.